Ateeksh. Actually, one night suddenly our son got a fit, which we were not able to recognize, and since he was in a fit for quite a long period, we rushed to Manipal Hospital, where we came to know that he got a hemorrhage and he was also having a tumor, a big tumor in his head, which was very critical. Our doctor was Mr. Anurag Saxena. He suggested us to go for a surgery. We were very scared because it was very critical, but the things went so well after surgery. My son is doing very well. He is very much similar to what he was pre-surgery, and we are very happy with the response that we got. Thank you.
So I would also like to thank the entire hospital staff, not only Dr. Kausik, and all the nurses who were playing a key role for his well-being. So we really like to thank the entire Manipal Hospital and the staff of Manipal Hospital. Thank you so much.
Ateeksh, a 30-day-old child with 3 kgs of weight, presented to emergency with abnormal movements of body, which was epileptic seizures, difficulty breathing, very shrill cry, and irritability. Now, this happened within a span of few hours, and worried parents brought the patient to emergency. Emergency patient post-stabilization was subjected to a scan, which showed 2 major problems. One was hemorrhage in the brain, and there was a brain tumor sitting inside. Now, what made this case unique and challenging was obviously the age of the child and the low weight, as well as a combination of brain hemorrhage and brain tumor in such a small child. Post-stabilization under watchful eyes of a pediatrician, patient was planned for surgery, and parents were briefed about all the challenges which we can have during surgery and after surgery. Obviously, it was a life-threatening situation, and the baby was very critical. The important things to be considered in this kind of patients is because of the low weight and small age of the patients, the blood volume is very less. So during surgery, it is very important to make sure that the bleeding is kept to minimum and blood loss cannot be afforded during the surgery. So the surgery, and we asked the parents consent for surgery, and after explanation we went ahead with the surgical procedure. Special techniques were used during the surgery to open the skin and the brain and take the tumor out, as well as a drain was placed to reduce the pressure. Now, during this entire surgery, the anesthetic role was very important to make sure that the blood pressure and all vital parameters of the baby remain stable. And during surgery, special techniques were used operatively and intraoperatively, as well as immediately post-operatively, to make sure that the blood loss is kept to minimum, as well as pressure on the brain is kept to minimum. The patient withstood surgery very well. He was shifted to pediatric ICU, and under pediatrician's care, he started gradually recovering. Within 2 days post-operative time, he started crying. He was weaned off from the ventilator. He started taking very minimal feeds, and eventually within few days he was back to his normal self. He was moving. His head circumference was absolutely fine. His all vital parameters, his activities, and his oral feeding became normal. He was discharged within few days of surgery, and he is doing really well. He is recovering well. He is achieving his milestones really well. So this case shows that even just complicated cases can be managed with perfect